We might have to do that.
Hello and good evening. Welcome everyone in. It'll take a minute for everyone to get here. And welcome to Lower Limb Masterclass, where this session I'll be talking to Claire Robertson and Tom Jacobs, both physiotherapists, about ACL and PFP, patellofemoral pain, and related risk factors about the two. First, though, let me give a shout out to our sponsor. Now, if you're prescribing great exercise plans, you want a great system to deliver them to your patients. And why not use Rehab My Patient? That is our favourite, the best and most flexible. You can get 3 months of Rehab My Patient for free by clicking on the banner at the bottom of your screen. That will open it up in a separate window. Come back to it later and grab your discount. To give you a heads up as well, familiarise you with the screen, you'll see a chat box and you'll see a Q&A box. Ask any questions you like throughout the presentation in that Q&A box. I'll be back at the end of the presentation to put those to Claire and Tom. And with that, I shall hand over to you both and I shall join you afterwards.
Thanks very much. So I hope you're hearing loud and clear. We're going to kick off our presentation, Claire and I, around ACL and patellofemoral pain related risk factors. So the first 15 minutes or so will be myself. I'll go through the ACL related ones, and then I'll hand over to Claire, who will take us through patellofemoral pain. So this is a topic that's well, we find very interesting. We hope you do too. And by the way, I hope you're not sitting inside like we are, but you're rather out in your garden or other with something cold in your hand. It's such lovely weather. So let's dive straight in to ACL injury and its related risk factors. So first of all, to give you a little bit of context, a lot of the experience that I've developed with understanding ACL injuries particularly in the last 7-8 years, has been from my role in a charity called Power Up to Play, which is aiming to reduce ACL injuries wherever possible amongst particularly the adolescent and child population in the UK. And we've been very lucky in that capacity to be able to go around the world and find out how it's going in other countries as well. The story that we're finding when we're speaking to clinicians and to researchers is that ACL injury rates are increasing over time, particularly in the last 10, 20 years or so. And we're not too sure in the respective countries why that's happening. The interesting thing also that I've learned is that the measurement of ACL injuries per se is not being gathered very accurately. We're quite good in this country in measuring how many people are having ACL reconstructions, but the actual rates of ACL injury are not particularly well known. And we have something called the ligament registry in the UK, where surgeons have to register when they conduct an ACL reconstruction, but otherwise exact figures are poorly understood. But the trends, as far as we know, are increasing. It's particularly prevalent, ACL injuries. I think most of us know what an ACL is, but when an ACL, which is this ligament here, ruptures, it more commonly happens in cutting, pivoting, jumping sports. Field-based sports are more common. Internationally, if you look at the absolute risk, again, I'm not sure quite how they've come to this kind of data, but if people are training, their relative risk is lower than if they are in matches, and it costs the NHS a significant amount of money, not just in primary reconstruction and rehabilitation for the injuries, visits to A&E, but also the associated increase in osteoarthritis and subsequent knee replacements that occur because of it. Injury rates in the UK, this is a published piece of work by some of the Oxford surgeons and researchers near my neck of the woods in the UK. And they published this in 2020, which the arc that you can see going up the most steeply is the 15 to 19-year-old age group, which is what I think has drawn a lot of attention in this country and concerned a lot of people in the amount of increase in ACL injuries. So we're talking about a 29-fold increase in the last 20 years in overall ACL reconstructions happening in the UK. And as much as we can probably say that some of that is down to more surgeries happening, an increased appetite for doing reconstructions in younger people and techniques improving that don't then block the growth plates. We're also seeing, as far as we understand, actual injury numbers going up as well. And that's what our international colleagues are also saying in their countries, USA being one of them,